And joining me now is former Acting CDC Director, Dr. Richard Besser. He is also President and CEO at the Robert Wood Johnson Foundation. Dr. Besser, thank you so much for joining us. Really appreciate it.
Thanks. It's great to be here.
Well, it's great to have you. I want to start by just getting your reaction to the choice of Robert F. Kennedy Jr. to head HHS.
Well, Kristen, when I heard the news, I have to say I was shocked. This could have devastating consequences on the health of so many people across America. I've spent my career working in public health, and to have someone leading the Department of Health and Human Services who has done so much to undermine confidence in vaccines is absolutely chilling. I practiced pediatrics for more than 30 years, and I know that there's nothing I did as a pediatrician that had more impact on the health of the children in my practice than making sure they were vaccinated fully and on time. It is the most impactful intervention that we have in pediatrics and in public health. And he has shaken confidence among so many people in this life-saving intervention.
You know, President-elect Trump has said he was going to let RFK Jr. go wild on health agencies. You talk about the vaccine skepticism piece of it, but I wonder what your biggest concern is, because as Dasha was laying out at the top of the program, there are a number of other controversial statements he has made, including suggesting he may look at the possibility of removing fluoride from drinking water.
Yeah, you know, the department, the head of HHS has a big role to play in terms of the budgets for the various agencies. During the campaign, he talked about eliminating whole branches and departments within the Food and Drug Administration. I worked at CDC for 13 years under Republican and Democratic administrations, and there was never, in my mind, any thought that the head of the department had a different view on the value of public health science in terms of determining what we did to protect the lives of people in America. Robert Kennedy has raised those concerns in a big way. And the big challenging thing here, and you see this with a lot of people who put forward so much misinformation, is that bits and pieces of what he says are really good and would be really valuable, but they're mixed in with so many falsehoods that it will be very confusing for many in the public to determine what is a good recommendation based on science and which is one that is based on some other set of information.
Dr. Besser, I'm wondering if you can help us understand. I mean, the HHS is one of the largest agencies. Talk about the complexity. What is required to be the Secretary of Health and Human Services?
Yeah, I mean, I've been talking mainly about the public health consequences, but it is a huge department. It is the department that is responsible for health coverage. There are 27 million people in America who lack health insurance. The confirmation hearings will be so important to get his take on health coverage. How does he see a path forward to closing that gap? What is his take on Medicaid and Medicare, these programs that provide health services for so many people, services for people with disabilities, services for people who have addiction. These are all things that are in the purview of the department, which is why you often see the head of the department being a former governor or a major business leader, someone who has managed very complex institutions and knows how to keep them moving forward in really important ways.
And I'm sure you have spoken to a lot of your colleagues. Can you share a little bit of what you're hearing from your colleagues in other health agencies about this pick?
Well, you know, what I hear is a hope that each person in the Senate will ask the question of themselves, is this someone who will help the lives of people in my state? That's critically important. At the same time, you hear people saying, well, if he is confirmed, maybe we can work together on nutrition. You know, our school lunch program needs a major overhaul. Could we get processed food out of our school lunch program? That would take a major investment so that schools in America would have the resources, the kitchens to be able to prepare a healthy food. But if he believes in getting corporate interests out, that's a terrific thing. And it would take some of the pressure off that we see every time the school lunch program is looked at. So there's this balance between, well, what are the worst things that could happen? And if he's confirmed, what are some things that we could potentially work on.
And, you know, one of the lines that we have heard from now President-elect Trump on the campaign trail when he was a candidate was the idea that various agencies within the U.S. government need to be overhauled. Are you concerned about the possibility that the CDC, NIH, FDA could in some ways be gutted or overhauled, and what would the implications of that be?
Well, I think we have to recognize that we can always do a better job. You know, one of the pieces of unfinished business from the Biden administration was really the work to restore trust and faith in our institutions, in public health, that was so shaken during COVID when we saw massive politicization of that public health response. Taking a look at the agencies and asking the question, how do you do your job better, is terrific. Coming in and saying, before you've been able to bring in expert perspective on this, saying that whole divisions have to go, you could see the loss within our public health system, within our whole Department of Health and Human Services, of a lot of talent that we need to keep ourselves healthy.
Dr. Richard Besser, thank you so much for your perspective on this Friday. We really appreciate it.
My pleasure. Thanks so much.
Coming up, President-elect Trump's return to the world stage and what we know about his policy agenda with ongoing hot wars in the Middle East and Ukraine. The top Democrat on the House Foreign Affairs Committee joins me right here in studio next. Stick around for that conversation. Plus, Steve Kornacki's deep dive at the big board, breaking down what happened in NBC's decider counties and what it tells us about this historic election cycle. Stay with us. You're watching Meet the Press now.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.